about a minute to join, and then we're going to get started. But I do want to let y'all know who are already here. First off, thank you so much for taking time out of your Tuesday evening to come to this workshop. It's going to be about 40 minutes. So just so you're kind of prepared on time with all of that. I know you guys are all busy, so I appreciate your time and I want to honor your time with all of that. So we will get started here in just a second. And yeah, let's get started. Let's do this. So I am Tristen Swengle, and I am a pelvic floor physical therapist. I've been treating pelvic floor now for 4 years, and I work at Vitality Pelvic Health as the director of pelvic health. And so today what I want to do is I want to teach y'all what a diastasis is, let you know how to assess it, all of those different things, and just give you valuable information to be able to move forward from this dysfunction that can cause a lot of just discomfort and pain and even just aesthetic, like not being very happy with our bodies after baby or anything like that. And if you guys are able to, and you've just got the time, I know you're all busy. If you're able to stay till the very end, we're going to be doing some different offer. We're going to be doing an offer overall. So if you guys are able to stay till the end, that would be awesome. So let's get started. Maybe. There we go. Okay, so this is just a little rundown for if you're wondering if this workshop is appropriate for you. And so first off, if you are currently pregnant and you're starting to notice any type of abdominal separation that you're noticing whenever you're maybe lifting or exercising or even getting up, if you have had at least one child or even multiple, and that could be vaginally, that could be through a cesarean, and you're noticing that when you try to engage your abs, maybe you're getting like a doming or a coning through your abdominal muscles. Also, if you you're having a hard time engaging your core muscles, like you know that your core is weak after having baby, and it's just really, really difficult for you to try to activate those muscles. And so that is a really great reason to participate in this workshop. Also, posture. Posture can be really difficult if our deep core and our abdominals aren't doing what they need to be doing. And so it might be challenging to maintain that nice posture. And then lastly, if you're ever feeling weakness in your pelvic floor, maybe that's with leakage, different things like that, and even low back pain. So all of those different things are reasons why this workshop can be beneficial for you. So kind of like we talked about earlier, this is just a little rundown on what to expect for today. So I want to teach you guys what a diastasis rectus abdominis or a DRA is. I want to teach you how to assess to know for sure if you have one, and if you do, be able to know how significant it is. And then we're going to do 2 different tests to get a good idea of what your personal strength is. And then the very last thing is going to be 3 exercises to start working on your core. So getting that baseline strength and then just giving you some tools to start to address that. So one of the disclaimers that I want to make sure and give you guys is to know that this is a workshop, but this is not in replacement of or in lieu of physical therapy. So this is not treatment. This is not medical advice. But what this is it's valuable information, but general. And so this is going to be different than if you were to come in for an initial evaluation with a pelvic floor physical therapist and they could specifically evaluate and assess you. That is going to be a very different process. And so these tools are meant to help you. They're not going to hurt you. And sometimes you might notice that if you do them, like, that didn't really do it for me. But whenever it comes to treating and assessing diastasis rectus abdominis, you need an effective plan of care that is personalized and customized to you, because you are an individual person. And so you might have noticed, oh, I've looked at YouTube videos, or, oh, I've done postpartum workouts. I've done all of these things, and I can't really seem to get my core engaged. I don't know what's going on. And so when you have someone who specializes in that and can teach you those different things one-on-one, that is the most valuable, the type of treatment that you can get. So it's going to be essential to be able to see a pelvic floor physical therapist in your area that can treat this dysfunction. So I do want to start with just a little bit of a story so you guys can kind of build a person up in your mind, and it might sound even very similar to you. So this is a patient that I treated a couple of years ago, and she presented, she was postpartum about 6 months after seeing her, or after having her second child. And so she was just noticing her core was weak, that her pelvic floor muscles kind of felt weak, and she wasn't really sure what was going on with all of that. So before she came into me, she had had like an uncomplicated vaginal delivery with both of her children, no issues with any of that. But then after her second, just noticed that her abdominal separation, it wasn't changing. It wasn't going away, and it was lingering a lot longer than it did after her first one. So she did what probably many of you have done, and what we would naturally do is she started to look up, Instagram videos and reels or YouTube videos to try and strengthen her core and get her core kicked back on. But it didn't seem like doing any of those things. She just couldn't feel her core. She told me she felt dead in her core, like it just wouldn't work. And so this started to filter into then with her two kids, she was having a hard time picking up her children because she couldn't use her core. And then it was starting to cause low back pain. And then with the pelvic floor weakness that she was experiencing, with a little bit of bladder leakage, that was just getting gradually worse. And so, of course, all of this is just causing so much frustration and all of that, because you now have these two humans that you're in charge of taking care of. And you need to take care of yourself. You're having pain, you're having leakage, you're not feeling like yourself. And it's hard to pour into other people whenever that is occurring. So finally, she came to physical therapy. This is kind of her last resort after seeing her OBGYN and different physicians that all just kind of told her it was normal. And this is just what it's like to be post-baby, which I'm sure many of you have also heard. And so what we did was we assessed and evaluated not only her diastasis, but we assessed and evaluated her pelvic floor, which as a pelvic floor physical therapist, you should be certified in doing. And we'll talk a little bit later about why it's so relevant to also assess the pelvic floor with all of this. And then because she was able to get a specific plan of care for herself, we were able to minimize her diastasis. She felt like her core was finally working. It didn't feel dead anymore. And then her back pain went away, and she no longer had bladder leakage. And this wasn't over a year's period of time. This was just over a 6-visit regimen. And so she just needed that specialized one-on-one care to be able to address her symptoms and her dysfunction. And then after that, she was able to get back into exercise. She started to feel more like herself, and even considered wanting to get pregnant again, which she thought was kind of out of the car or off the table for her, just because of how she was feeling after having baby. So it's something that you do not have to live with. It is not normal, and it can absolutely be treated. So, you have those outliers, of course, where it's not, you've got that one person who, okay, we have to do something different. But for the most part, this does very, very well being treated conservatively by a pelvic floor physical therapist. So what is diastasis rectus abdominis, or DRA? And so it is an abdominal muscle separation of your rectus abdominis muscles or the 6-pack muscles, which you can kind of see in this picture. If you can see my mouse, you've got this opening right through here, right around her belly button. And so not only is it the muscles that are separating through there, but there's also this tissue called connective tissue, and that is your linea alba, and that is also stretching apart. This is usually occurring in the 3rd trimester of pregnancy, usually about 35 weeks. But it doesn't occur in everyone. But it will occur usually around that time if it does. And it's just that stretching with baby growing. And so these structures are so important because their job and their purpose as our abdominal muscles and the surrounding tissues like our linea alba, they are meant to protect our viscera or our abdominal organs. Then they're also important in us being able to maintain our posture. And then lastly, stabilizing our pelvis and our low back. So they're not just these aesthetic muscles, they actually serve a very important purpose. And so if there's dysfunction or problems with that muscle, it can cause so many other things other than just this doming, this separation. And so it's something that needs to be addressed. But some of the things that can contribute overall to a DRA is just having one pregnancy. It can be having cesarean section or vaginal delivery. It can be multiple pregnancies, considerable weight loss in like a quick period of time, and then even any other abdominal surgeries. So even though we've talked a lot about pregnancy and postpartum, there are other things that can contribute to these symptoms, even if you've never had children. Okay, so now we're getting into some of the good stuff whenever it comes to what you guys can do to start to assess your own diastasis rectus abdominis. And so there's actually 3 different ways that we're going to test this, and I'm going to have you guys test it. And so the first one is back to that linea alba. That is that connective tissue that we were talking about between those 6-pack muscles. And so what you're going to do is you are actually going to be in this exact position that the picture is in. So on your back with your knees bent up and your feet flat. And then you're using your fingers and you're going to be starting up at your breastbone or your sternum. And then between your 2 6-pack muscles, you are going to be assessing and feeling the tension just with a light pressure. It doesn't need to be super heavy, but you're going to be pushing down and assessing that tension all the way down towards your pubic bone. And this is all being recorded. So you're able to come back and watch this, or if you wanted to like take a break and go ahead and do it right now, you absolutely could, or just keep watching while you're still assessing. And so you're using your fingers to assess. And I just want you to note, like, what am I noticing there? Do I have a lot of tension? Can I sink in pretty good through there? And then taking note of that so that that is something you can look back on. So that's going to be the first way to assess, and that is mostly for the tissue. And that's that linea alba again, that really protects those abdominal organs, that viscera through there. And then, yes, okay. So another way, or the next way, because all 3 of these are going to be beneficial. So the next way to assess your DRA is going to be the standard way to see how much separation is between those 6-pack muscles. So you're actually going to be in the exact same position as you were in before, but you're not going all along the rectus abdominis anymore. You're going to actually start about 2 to 3 inches above your belly button. And I want you all to start with 2 fingers when you're doing this. So you're still on your back, your knees are bent up with your feet flat. Using your index and your middle finger, you're going to be 2 to 3 inches above that belly button, and you're going to sink in with a decent amount of pressure. And then I'm going to have you tuck your chin and barely raise your shoulders up off the floor. You're not even doing a full crunch. And what you're feeling is, can your fingers sink down? And do you feel any pushing in on the side of each of your fingers? And if you feel like it pushes pretty hard, then that would be considered a 2-finger separation. Now, if you feel like, I think I could fit a couple more fingers in there, or even 1 more finger in there, or half a finger, note that as well to see how many fingers you can fit down and that are pushing together whenever you do that little mini crunch. So you're going to do that right above your belly button. And then you're going to repeat it again right below the belly button. And then lastly, 2 to 3 inches below your belly button. So assessing at those 3 different spots and making note on each spot how much separation you're having. And we'll look at here in just a little bit the different types of separation, because not all DRAs are the same. So the separations can definitely vary through there. And then the third way is going to be through a breathing technique. So this is seeing what happens whenever you implement a focused breath. And so again, same position, that makes it pretty easy. You can do all 3 of them just back to back. And then you're still feeling in between your 6-pack muscles. But what you're doing this time is you're taking in a full inhale, really deep breath, and then you're going to exhale fully. You're not forcing it out, but you're exhaling through pursed lips all the way until you've gotten all the air out, and you're feeling what you're noticing between those two six-pack muscles with your finger. So those are the three ways that I'm going to have you assess for your diastasis. I find that it's helpful to make a note either in your phone or on a notepad or something like that, so that you can feel, and then you can look back on, okay, that's what I found whenever I measured it. And then this is something, so just like you did in the one before, you went 3 inches above your belly button, right below your belly button, and then 2 to 3 inches below it. So you're doing that same thing with this breathing technique and looking at all those three places. So you might have even noticed whenever you did that it was different between the second assessment that you did and then this third assessment, that maybe I had more abdominal separation or less abdominal separation. And we're going to get into that once we're talking about exercise here pretty soon as to why that can change. So I told you guys that we were going to talk about we would discuss and kind of look at the different types of diastasis. So you can see in this first picture, the six-pack muscles are all together. There's no separation through there. So no diastasis. There is the type of separation where it can only be above or below the belly button. And then the type where it's only around the belly button. It can even occur more above, to where it's all come together down closer towards the pelvis, but anything above the belly button, you're noticing more of that bulging through there. And then lastly, it's more of a symmetrical, you're noticing that bulge kind of all along the six-pack muscle. And the reason why this happens, we're not entirely sure, but sometimes it can be due to the way that you carry baby, or anything like that can cause the type of diastasis that you experience. But either way, regardless of the type, they all do very well with, for the most part, I should say, because there are those outliers, they do well with pelvic floor physical therapy to work on approximating or bringing those muscles together. So now that we have assessed, or we know how to assess our diastasis rectus, we want to go into, and we know what abdominal separation is. The next thing is core strength. So how strong is my specific core? And so I'm going to give you 2 different ways to test that. And they're very easy things that you can do at home. And so the next thing with your core strength testing. So yes, this is a crunch. And many times people are told if they have a separation, oh my goodness, absolutely do not do a crunch. That's the worst possible thing you can do. And that is actually incorrect. That's outdated information. It's inaccurate information. And we'll talk about that in a little bit, why it's actually not true. And so what you're going to do for this first core strength test is you are going to set yourself a 30-second timer. And then what you're going to do is you're going to start out in the position that she is in right now. So very similar to how you assessed yourself earlier, but knees bent up, feet flat. You can cross your arms over your chest. You can have them reaching out to where you reach for your knees. They can even be behind your neck, whatever feels natural, or even by your side. So whatever feels natural for you. And even sometimes I'll have people, if you've got someone there with you, they can hold your feet down, or if you're in your living room, you can put them underneath your couch just so your feet don't feel like they keep coming up. So what you're going to do once you're set in the position is you're going to set yourself a 30-second timer. Now, once that 30-second timer starts, you are going to do a full sit-up. You see how she comes all the way up, almost where her knees are touching her elbows are touching her thighs and her knees. So a full sit-up all the way up and then all the way back down. And you're going to see how many repetitions you can do in 30 seconds. And then you're going to write that number down, because this is something that you're going to want to look back on. And it's kind of a nice and fun way to be able to track your progress. Whenever I first tested this, I was able to do 6 sit-ups, and now I can do 9. So it's kind of a nice gauge to know if you're seeing any improvement with your strength through there. So now the next one is the plank, which the plank is a great core exercise, but it's also very challenging, and we can do them incorrectly very often. So there's different types of planking that you can do based on just your overall fitness level. And so you just modify it based on what your body needs and what it can do. So you have your standard plank in the lower left-hand corner, and that's up on your toes, all the way straight on your elbows. And you want your body to be quite literally a plank, of course, nice and straight. You don't want your bottom up in the air, and you don't want your hips sagging down towards the floor either. A modified version of that plank is going to be to have your knees and feet on the ground and then on your elbows. That just makes it slightly easier, but don't let it trick you. It is still pretty challenging to do a plank that way as well. And then the last way, if both of those are just not doable for right now, then doing it up on a countertop, like in the bottom right corner, elbows straight, almost like you're in a push-up position, and then holding that position. But in all of them, you don't want your back to be swaying, you don't want your hips down, and you don't want your bottom up in the air. You want to feel like you are a board. And then I want you to hold that position for as long as you can. So you're just going to set a timer and go until you can't hold it any longer. But your form is important. It becomes kind of useless if you're doing it and you get to the point where your hips are sagging. You're like, I'm still holding it. But if you're not maintaining the good form, then it's not benefiting you when you're doing that. So getting a good idea of how long can I hold those different plank positions. And just like we did with the sit-up test, this is something that you can go back on and look at and say, okay, whenever I first did this, I held for this long, and now I'm holding for this long. Or maybe I went from doing a plank up on a countertop to now I'm doing a modified plank on my knees. That's progress, even if it's holding it for the exact same amount of time. So while you're doing this, pay attention to any back pain that you're experiencing. If you start to experience back pain, that's when you're going to stop. And so, or if you can't maintain the position. So I do want to take a little deeper dive into what your core is, because a lot of times we just focus on the aesthetic muscles that we can see. And so I like this picture a lot because it really gives us a good idea. You've got right here your six-pack muscle or your rectus abdominis. And then you can see that white tissue in between. That is your linea alba. That is that connective tissue that we talked about that will stretch. And then you have your two oblique muscles. You've got your external oblique here, and then your internal oblique here. And those three layers, they are all your movers. They are the muscles that help you bend forward, twist to the side, and side bend. And they're very important. Then your deepest abdominal muscle, the fourth layer, is your transverse abdominis or your transversus abdominis. I also call it the TA a lot. And it is not a mover. It is actually a stabilizer. So I kind of compare it to a girdle muscle, and it stabilizes your spine. And then it's also neurologically connected to your pelvic floor. So we talked about how core strength and pelvic floor weakness can go together. And when this muscle comes into play, those areas definitely need to come together to work together. So much is happening in your core and so much that we need to address and work on. It's not just one area. It's not just that six-pack muscle that we're working on through there. And I did tell you guys whenever we were talking about the crunch a little bit earlier for your core strength testing, that we're often told that is a terrible thing that you should do if you have a diastasis. Don't do it. Like that just makes it worse. And so actually Lee and Hodges determined and did some different EMG testing to determine that whenever you do a crunch or a sit-up, what happens to the six-pack muscles is they actually come closer together. So that distance is decreased. Now, in addition to that, they learned that whenever the transverse abdominis or that deepest abdominal muscle was engaged, that it caused more separation of your six-pack muscle. And so it seems counterintuitive to do both of those, but we want to do both of them together to overall stabilize and progress our core strength. And then that overall gives us the best results to do those two things together. So if you've got any friends that are like, oh my goodness, don't do crunches if you have a six-pack muscle, you can tell them, actually, research shows us that doing a sit-up or doing a crunch pulls those muscles together if we're doing them appropriately. There is a time when you don't do a crunch, and that's if, you feel like if you have a large separation and it's almost like your intestines or something like that are pushing through that linea alba. You don't want to do a sit-up because then approximating that, bringing those muscles together can constrict those bowels, and that can cause a lot of issues. So that would be a time that a crunch or a sit-up would not be the safest thing to do. So now we're going to get into the exercises. There's going to be 3 exercises that you guys are going to do. And I just wanted to talk about like how often you're going to do these, how long it should take, and then the intensity overall of the exercise. And so whenever it comes to how often, you can do core exercises daily if you wanted to. You could do them every single day of the week. You're just paying attention to what your body is feeling in terms of muscle soreness and fatigue and all of that. So there is a time when you can definitely overdo it, and every person is going to be different with that. And so determining what frequency is best for you whenever you're doing these different exercises. The other is duration, like how much time do I need to spend on my core muscles? And overall, we want to spend about 20 to 45 minutes of exercise a day with a total of at least 150 minutes a week. And that is split up into different types of exercise. So that is not just for your core. So your core is implemented into that overall 20 to 45 minutes a day that you're going to be getting. And then lastly, the intensity, you want it to be challenging, but you don't want it to be impossible. And so the amount of energy that you're using, you should be able to complete a full 20-minute or 45-minute or however long workout without completely wearing yourself out just on your core exercises. So not doing too much with all of that. Okay, so here's the easy thing about the exercises, guys, is you are actually just going to be doing 2 of them actually are ones that we've already talked about. And it's your plank or your modified plank position, and also the traditional sit-up. And so we've got pictures of both of those. And then the third one we'll talk through here in just a little bit. But what I want you to start with, based on what you found when you tested your strength, is if you were able to do, a full plank for up to a minute, that's awesome. You could maintain the position, you felt really strong, you didn't have low back pain, you did it for a minute. I want you to rest for at least a minute, and then you're going to repeat it. And I want you to repeat it up to 3 times. If you can maintain that good form, you've got that strong, your core is active, you're not having back pain, and that could be your standard plank, your modified plank on knees, or your modified plank on the countertop. So starting with about 30 to 60 seconds in whichever position you can be successful in. And then giving yourself that nice break in between and doing it 3 times. So then the second is your traditional sit-up. So similar to how you tested your strength earlier, but you can have someone hold your feet down so your feet don't feel like they're going to come up in the air, or like we talked about, sliding it underneath your couch to kind of hold your feet in place, or just any space that you can put your feet underneath, and then doing those full sit-ups, getting your elbows all the way to your knees, coming all the way up, all the way back down. And what I like to do, we talked about that breathing. Whenever you're crunching, exhale as you crunch, and that is going to help engage those muscles and pull all of that together as you're doing your sit-up. So 10 repetitions of that, taking a nice break in between 30 to 60 seconds, and then repeating that 3 times. And then the very last one is one that I really enjoy doing and is great for your core, and it is the bird dog or a modified bird dog. And so I'm going to show you the standard picture of a bird dog, and that is here right now. And so you actually start off in an all fours position, hands and knees. And then what you're going to do is you are going to test it out first. So the standard is your opposite arm and opposite leg are going to extend away from your body. Now, the position of your pelvis does matter. You're not trying to donkey kick where you're extending way, way up through your leg and really arching through your back. That's not really doing anything for your core there, but you're kicking straight backwards. And I tell people to imagine you have a glass of water on your pelvis, like right on your back. And as you kick back with your leg and then forward with your arm, reaching, you do not want to knock that glass of water off. An easy tip with that is you could, if you have a yoga block at home, you can put a yoga block on your back and then balance that while you do this exercise. So this is the standard one, opposite arm, opposite leg. The modified version, you get to kind of see what your body needs. So if you start off in all fours with the modified, the way that I have people check it first is move 1 arm at a time. You're not raising your head. Your spine, like you can see hers, is very neutral. And then you're raising 1 arm at a time, just up to shoulder height, and then coming right back down. And then you're switching to the other side. If that feels really easy, then you need to do something more challenging. So then it comes to your arms are going to stay flat and you're going to kick back one leg at a time, still maintaining that nice line, not arching through your low back, kicking it straight back and then returning to that start position and alternating between each leg. If the arms is too easy, but the legs and kicking it straight back feels like too much of a challenge, I will have people do a toe slide to where your toe slides against the ground, but you're still extending it all the way back before you bring it back to the start position. So those are some different modifications that you can do for the bird dog exercise. And the whole time you're thinking about bracing your core as you're doing that. And then just like with that one, with the other ones that we talked about, doing 3 sets of 10 on each side. After you've done a set of 10 repetitions, giving yourself a break in between there. I do recommend on this one doing it on a yoga mat or something like that because it can be a little sticky on the wrists. And so if that position is uncomfortable for you at all, getting to the point, I'll even have people go on fists sometimes so that their wrist can stay nice and neutral. And that tends to be a little bit more comfortable for people. So those are the 3 exercises: the plank, the sit-up, and the bird dog. And like we talked about earlier in the workshop, these exercises are meant to help. They are not overall, they're not treatment. They are not going to completely resolve. And you might even do them and find that, those don't help me. There is a whole slew of different types of exercise and different things that we prescribe people depending on their fitness level and what their body needs. And again, that is when it just becomes so beneficial to get to go in and see a pelvic floor physical therapist who specializes in this, and to where they can give you a specific tailored program that's for you. And then it also allows you to meet your specific goals. We all have different fitness goals. Some of us might be CrossFitters. Some of us might just enjoy walking for exercise. And all of those different levels in between are wonderful. Movement is just important for our body, and our body needs it, especially after we've had children or if we're currently pregnant. Some level of fitness is so, so important for us overall. So again, these are tools. They're meant to help, but they are not overall treatment whenever it comes to that. So then lastly, what I want to let y'all know is you made it through. It was about 35 minutes. So thank you guys for hanging out for that whole thing. But again, like I said at the beginning, my name is Tristen and I am the pelvic floor physical therapist at Vitality Pelvic Health. And if this seemed like valuable to you and you feel like it would be helpful for you to get in for an initial evaluation, I always recommend it postpartum. If you have, regardless of how postpartum you are, if you're just 6 weeks or if you're 10 or 15 years, it is always beneficial to be able to have someone assess your abdominals, your pelvic floor, like we talked about, your back and your hips and your pelvis, because like we talked about with the core and what it does is it controls all of those different areas and posture. And there's just so many different things that are involved. It's not just this coning or this separation that we're experiencing. And so if this felt like valuable information and you guys are like, oh my goodness, I would really love to get in, this is our contact information. And so we are located at 91st and Sheridan, Vitality Pelvic Health. And I put on here our phone number, which you can call or text. And then also my email. So if you have any questions about the workshop or you're not really sure if physical therapy is appropriate for you, you just have different things you want to ask before pursuing that, you can absolutely send me an email and I will get back to you as soon as I can. And then lastly, I put our website on here as well. So if you're like, oh, I don't even need to talk to her and you want to schedule an initial evaluation, you can do that on our website as well. And you can also get other information on there of other different things that we treat in terms of pelvic health with all of that. So I did tell you guys that there was going to be an offer if you stayed until the end. And so what we're offering is if you want to text pelvic to our clinic phone number, which is listed on this slide, then we are going to give you a discount of a $67 initial evaluation. And that is usually $170. So it is a steal whenever it comes to that. So if you text us that, I will give you a call tomorrow. You all have things to do tonight. And so I will give you a call tomorrow. And even if you just want to send that and like, I want to ask her some questions, then absolutely go ahead and send that to our clinic number, and then I can reach out and contact you tomorrow. Or if there's a better time for me to contact you, you can always let me know that as well. So thank you guys so much for your time. I appreciate it. I hope that this was helpful and informative and valuable information for you. And I hope you have a great night. So thank you so much.